to watch for anybody else that would like to record. We're going to get started. My name is Lynn Sutphin. I am the Public Information Officer for Health at the Michigan Department of Health and Human Services. And today we have a presentation about the COVID-19 vaccine, information about distribution, priority groups, and other details that are going to be provided by our experts. Our speakers today are Bob Swanson, who's the Director of the Division of Immunizations at MDHHS, and of course, Dr. Joan A. Caldoun, our Chief Medical Executive and Chief Deputy for Health at the department. I'm going to turn this over to Bob Swanson now and let him kick this off.
Hello all, good afternoon. This is an exciting time to talk to you about the COVID vaccine and as we prepare to receive this vaccine into Michigan very soon. Next slide, please. I'd first like to talk to you about the process used to prepare to get this vaccine ready for what is imminent here in the next few days. The vaccine does move through a three-phase process in the testing of this vaccine. The FDA authorizes and uses the vaccine. Currently, it's being done under an emergency use authorization. We expect eventually it will be fully authorized by the FDA. The only difference between the full authorization and the full approval, or the EUA use, is that that you have to wait about 6 months after the clinical trials before it gets full approval. So the Advisory Committee on Immunization Practices will be holding meetings once the FDA is finalized, and they will then make recommendations on the vaccine. The Advisory Committee on Immunization Practices is a group of vaccine experts that will make recommendations for the use of this vaccine within the United States. They don't just do COVID vaccines, they make recommendations on all vaccines. They're the ones that give us the guidance on who should receive it and what the intervals and the use of the vaccine is. Next slide, please. This infographic sort of talks through the steps in the clinical trials. The first phase is a smaller group of individuals that are used, that the vaccine is tested on, just to assure that it's safe. And at this point too, they're looking at the appropriate dosage to be used for the vaccine. Phase 2 opens it up to several hundred volunteers that work so that they can study it in a little bit larger group and look at the efficacy of the vaccine. And then finally, by phase 3, it's thousands of people. Actually, for this Pfizer vaccine, there were 43,000 people that were in the clinical trial for phase 3. And fortunately, we had some very positive results as a result of phase 3. Next slide, please. So I just talk about the approval process just for a minute. Vaccines are approved only after they have been held to the highest safety standards. By the time the vaccine is approved, it's been reviewed by all the top medical and immunization experts across the country. And that's all part of ACIP, the Advisory Committee on Immunization Practices, but it goes well beyond that as well. The COVID vaccines have been developed much faster this time than what we've seen before. It's really been unprecedented because of the worldwide collaboration of scientists, medical doctors, health and governmental officials to assure that this vaccine could move forward quickly. The collective effort really has allowed researchers to shorten that typical time without sacrificing the safety or the quality. And in fact, no steps were skipped in this process, that it's continued to follow the exact same steps that we would for any other vaccine. Next slide, please. I do want to talk a little bit about side effects because they've been in the press a little bit. As with many vaccines, there is the potential of mild side effects, such as, redness at the injection site, sometimes fatigue or mild fever. These side effects with this vaccine really are fairly minimal. But and truly, that's your system, your body, showing that there is an immune response to this vaccine. The potential side effects, if they were to occur, if there were any serious side effects, those would normally happen within 30 days and we would know about that. On the next slide, I talk about the safety monitoring that's in place. VAERS, which is the Vaccine Adverse Events Reporting System, is a system that's been in place for years to actively monitor vaccines. They're very heavily monitored for safety and will continue to do that with this vaccine. But CDC has really stepped up the surveillance, active surveillance for safety monitoring with this vaccine, just to assure and make the public feel comfortable with this vaccine. They've set up a system called vSafe. With every dose of vaccine that's administered, individuals will receive a flyer that talks about the vSafe program. It's something that you can enroll into with your smartphone. You go to a website, you put in your information. That vSafe system then will contact you over the next week to monitor if you've had any adverse events, even sore arms, that type of thing. If in fact you did detect something that was bad, if something was reported that was a serious side effect, there would be follow-up from CDC and a VAERS report would be issued on that. So a very active vaccine monitoring system in place to assure that this vaccine rolls out in a safe manner. Next slide, please. I'm going to move a little bit away from the approval of the vaccine and the safety of the vaccine into what we know here in Michigan and what's coming. As you probably all know, the FDA has met and they had their initial vote yesterday and approved the vaccine to move forward. That isn't the final stage. At this point now, there's a final blessing that comes from the FDA that's occurring most likely today. The next step in the panel, in the step would be that the Advisory Committee on Immunization Practices will meet, and they're actually meeting today and will meet again on Sunday. It's likely that Sunday they will be taking a vote to make that final recommendation. It's with the ACIP that we learn all the intricacies of the vaccine and how it should be administered, to what individuals it should be administered, along with the prioritization groups with it. Michigan's initial supply of this vaccine, which we are, if everything goes smooth, we're expecting to receive next week, will be 84,825 doses, which will be allocated to hospitals and local health departments that have ultra-cold freezers. And it's important to note that they have the ultra-cold freezers because this vaccine requires it -70 degrees below, -70 degrees centigrade below zero to be able to store that vaccine. So we are making sure that the hospitals and local health departments that have those types of freezers will be able to manage that vaccine. Future allocations that we're going to be getting over the upcoming weeks will all go to federal long-term care pharmacy partnership. This is a partnership with Walgreens and CVS, where they will be vaccinating individuals, both staff and residents within long-term cares, to help assist us in this vaccination effort. It's a very strong partnership that we've got underway, and that's really going to help get us a long way in our vaccination program. But mostly I've talked about the Pfizer vaccine because that's the one we're hearing about in the news right now. But the Moderna vaccine is really short behind. They also submitted for EUA to the FDA on the 30th. We are expecting that vaccine by the end of the year. CDC forecasts it could be somewhere around the 22nd of December, so we're hoping for that. And then we will have that vaccine with a broader distribution. That vaccine doesn't require quite as stringent storage, and it comes out in smaller dosages, 100 doses opposed to 1,000 doses for Pfizer. And so we'll be able to distribute that wider for those health departments and those hospitals that don't have ultra-cold freezers. We'll be able to distribute that vaccine to those individuals. We did receive a larger allocation of that, about 173,000 doses. So we'll be able to make that quite a wide distribution so that we can have access to those priority groups when vaccine is limited. Next slide, please. So as I talked about the initial limited number of doses that are going to be available, ACIP, again, will be providing guidance on those priority groups on who should be receiving that vaccine first. There's several phases that Dr. Khaldun will talk about with trying to get the priority groups vaccinated. And then later it will be opened up to the general public once we get to those initial priority groups. And as I said before, those initial distributions, because we want to get to the priority groups, will likely go or will go to the hospitals and the local health departments. Next slide. This is what our allocation is going to look like for that 84,000 doses of vaccine that we're receiving. We're looking at the emergency preparedness regions across the state, and you can see it's pretty widely distributed across the state. You can see the number of health departments within each region and the number of hospitals that will be receiving that vaccine, so that there will be access for all healthcare providers, we anticipate, within the first 2 weeks of this program. The Moderna vaccine, which will follow, as I talked about, that will be available to the remainder of the hospitals and local health departments. And then we do expect ongoing weekly allocations from CDC. So we'll get additional doses of vaccine to cover all healthcare workers in the upcoming weeks. Next slide, please. So I did want to talk about how we're managing this program and what we're using to track the vaccine that's there. The Michigan Care Improvement is a statewide immunization registry that has been operational since 1998 in Michigan. This registry tracks all the immunizations, in particular for kids, but also adults, so that if you move from one physician office to another, that you're aware that they will know which vaccines are administered, so that we don't under or over vaccinate individuals. So we will use this registry to track immunizations, the COVID vaccine, and know when the first dose and the second dose are administered. It allows for the collection of data so that we can transmit aggregate data to CDC. It's large. It contains right now 11.6 million person records, 156 million shot records, and we have over 16,000 active users in the system. So that's how we can manage the inventories of the vaccine and know who's receiving the vaccine. Next slide, please. With that, I'd like to turn it over to Dr. Joe Khaldun, the Chief Medical Executive for Michigan Department of Health and Human Services.
Thank you so much, Bob. And before I continue, I'd like to give people a reminder to please mute your microphones. Okay, I was muted. All right, so as Bob said, I am very excited about the vaccine distribution. It means that the end of the pandemic is near, and we are working diligently with partners across the state to distribute the COVID vaccines when they do become available. We know that supply of vaccine will be limited in the beginning, but we have made an operational goal to vaccinate 70% of adults over age 18, or about 5.4 million people, by the end of 2021. I'm going to pause for another moment and please request that everybody mutes their computers or telephones. We expect this goal to potentially fluctuate as we learn more about the vaccine, immunity, and more vaccine products become available. This age range is also subject to change based on final guidance from the CDC on what ages the vaccine will be approved in. MDHHS is actually following CDC and ACIP goals and ethical principles to prioritize allocation of COVID-19 vaccines. The goals are listed here. It includes decreasing death and serious disease as much as possible due to COVID-19, preserving functioning of society, reducing the extra burden the disease is having on people who are already facing significant disparities, and also increasing the chance for everyone to enjoy health and well-being. We are also using ethical principles to guide our decision-making process for when there is limited vaccine available, which we know is the case right now. Again, this is based on ACIP recommendations. So it's listed here. It includes maximizing benefits and minimizing harms. This means respect and care for people, using the best available data to promote public health and to minimize death and severe illness. It also means addressing health inequities and mitigating them, reducing the health disparities that we've seen in the state of Michigan and across the country with the burden of COVID-19 cases and deaths, and making sure everyone has the same opportunity to be as healthy as possible. Promoting justice. This means treating affected groups, all populations and communities fairly, and removing any potential barriers to access to the COVID-19 vaccine. And then transparency is incredibly important. We need to make decisions that are clear. We aim to make them understandable and open for all to review. And we also, throughout this process, have and will continue to seek public participation in the creation and review of our decisions when it comes to this vaccine. We're also using the CDC Social Vulnerability Index for targeting distribution of supplies for the vaccine by geography within a phase of vaccination, which I'll get into in a moment. So this Social Vulnerability Index is made up of indicators of socioeconomic status, household composition and disability. It includes minority status, language spoken, housing type, and access to transportation. This status in Michigan communities correlates with the communities actually hardest hit by COVID-19 this spring, as well as areas of the state with high rates of risk factors for severe COVID-19 outcomes. Of note, this was also considered in identifying testing sites for COVID-19 across the state. MDHHS is also following CDC recommendations for prioritization of distribution and administration of COVID-19 vaccines for adults, again, which are based on recommendations from ACIP. We've also provided guidance on how to think about prioritizing within 3 particular categories based on the principles that I've discussed. It is important to note that vaccination in one phase may not be complete before vaccination in another phase begins. That means there may be vaccination of individuals in different phases that actually occurs simultaneously. The timing of the start of vaccination in a phase is dependent on the supply of vaccine from the manufacturer, how the vaccine is allocated from at the federal level to Michigan, and the capacity to administer the vaccine to these specific populations. So these are the phases, again, based on the principles that I discussed and based on recommendations from the CDC and ACIP for the populations that will be vaccinated. So phase 1A includes paid and unpaid people who are serving in healthcare settings. They may have direct or indirect exposure to patients or infectious materials and are unable to work from home. And also this includes residents of long-term care facilities. Phase 1B, excuse me, also includes some workers in essential and critical industries, including workers with unique skill sets, such as non-hospital or non-public health laboratories and mortuary services. Phase 1C includes other adults who are at high risk for severe COVID-19 illness due to underlying medical conditions or the fact that they are age 65 or up. And then phase 2 is a mass vaccination campaign for all adults who would not fit into those previous categories. Next slide, please. So now I'm going to talk a little bit about how we're recommending prioritization within all of the categories that I just described. So the first priority group within 1A is critical healthcare infrastructure. So these are people who perform direct patient care and work in critical areas as well. So you can see them listed here: EMS providers, including medical first responders, staff working on general medical floors, in emergency departments, and intensive care units. Of note, this would also include trainees, so that may be medical or nursing students. It would include therapists, clerical staff, environmental services, and other staff who may not actually provide direct clinical care, but who could still be exposed to infectious agents that can be transmitted in a healthcare setting. Next slide. The goal of the second priority, again, this is still within phase 1A, is to prevent outbreaks in long-term care facilities. So this priority is broken into 2 groups. Group A is workers who have direct contact with large numbers of vulnerable residents, including staff who come in and out of buildings. This includes those working in skilled nursing facilities, psychiatric facilities, homes for the aged, adult foster care, assisted living facilities, and home healthcare workers who care for high-risk clients with large patient loads. The second group, that's group B listed here, involves vaccinating the residents in these facilities. For these priority groups, there may be vaccination of people in both groups simultaneously. For example, as discussed earlier, there's a federal long-term care pharmacy program that is being conducted in partnership with pharmacies that will vaccinate both staff and residents of long-term care facilities. The next priority, again, still within phase 1A, has a goal of keeping other necessary healthcare infrastructure functioning. So this would include healthcare workers who conduct high-risk procedures, and that may include dentists, GI specialists who do endoscopy, those who perform dialysis, or others, many others that may not be listed here. It also includes workers who have direct patient contact in outpatient settings. So this might include primary care offices, FQHCs, urgent cares, or home healthcare staff. It also includes workers with specialized skill sets who may not be involved in direct patient care, but are still critical to keep healthcare functioning. So that would include hospital and public health laboratories or pharmacies. So the next phase is phase 1B, and that includes other essential workers who really keep critical infrastructure in society open and functioning. We will consider the critical infrastructure as defined as the Cybersecurity and Infrastructure Security Agency's Critical Infrastructure Protection Program, as well as continuity of operations plans for these industries. We will also prioritize staff working in congregate settings other than long-term care that I just described. So these groups include K through 12 school and child care staff with direct contact with children, some workers who are identified in the Critical Infrastructure Protection Program, so you can see them here, chemical, communications, dams, emergency services, financial services, government facilities, IT, transportation, energy, food and agriculture, other healthcare and public health, nuclear reactors, materials and waste, and water and wastewater systems. This also would include staff in this phase. It would include staff in homeless shelters, corrections facilities, which would include prisons and jails, but also juvenile justice facilities, congregate child care institutions, and adult and child protective services staff. This may also include workers with unique skills that have not been covered above, such as non-hospital laboratories and mortuary services. So the next phase is phase 1C, and this includes individuals who are at high risk of severe illness due to COVID-19 infection, so including people over age 65 or people who have underlying medical conditions. So that would include conditions such as COPD, high blood pressure, chronic kidney disease, diabetes, obesity, or several other conditions that have been identified by the CDC that put someone at high risk of negative consequences due to COVID-19. It's important to note that at this time, vaccination for pregnant women and children is actually not recommended because of limited available data on the safety and efficacy of the vaccines in these groups. As more data becomes available and we get more information from ACIP and the CDC, this could change, and we do await more guidance from them. Phase 2 includes all other adults age 18 and up who do not otherwise fit into these other categories I described. Again, it's important to note that for all of these phases that I just went through, there will be overlap when one phase is not yet completed and another one begins. And the timing between the phases depends on availability of vaccine, how and how much vaccine is allocated to Michigan, and the capacity to administer the vaccine to these various populations that I described. It is our hope that we will be able to start offering the vaccine to the general public by late spring of 2021. So a lot of people have asked about how these vaccines are actually going to be administered and who will be administering them. So we have many partners across the state who are working at the local level to be able to administer these vaccines. So especially for our hospitals, they will be our healthcare workers, hospitals will be a key place where our healthcare workers will be vaccinated. We're also working with pharmacies. In the very beginning, they will be important in vaccinating in our long-term care facilities, but also as we get out into vaccinating for the general public, as 2021 goes on, pharmacies will play an important role. We also are working very closely with our local health departments who have been on the front lines throughout this pandemic, providing services. We are also working with emergency medical services, so medics and others who may have the clinical skills to be able to administer vaccines. The Michigan National Guard is also an important partner that will be helping us to vaccinate some populations. And then we are also going to be partnering with outpatient clinics, whether that be primary care offices, federally required health centers, and others, so that we can administer vaccine, particularly when we get out into some of these more vulnerable populations or into the general public. So I'll just end by saying the situation is continuously evolving, and please, for the most up-to-date information, please be sure to check our website, michigan.gov/COVID vaccine, for the most up-to-date information. Thank you, Lynn. I'll turn it back over to you.
Thank you very much. I appreciate that. Okay, we are going to have a few minutes here for some questions. I have a couple of instructions for you. If you are on a phone, you need to do a *9 to unmute yourself once I announce you. If you want to ask a question, please raise your hand. And when you are asked to, given the opportunity, please announce yourself and your affiliation so that we have that for the tape as well. All right, we're going to start off with Ben Solis over Gomer. Ben, go ahead, unmute yourself and ask your question, please.
Hi, Lynn, thanks. This question is for Dr. Khaldun. I'm wondering what phase group our legislators fall into. When will they get vaccinated?
So excellent question. I will say they are probably included. I'll have to get back to you on that, to be honest. I think they would potentially be included in critical infrastructure, phase 1B, but they may also, again, depending on age, of course, and whether they have high risk of severe illness, that may be included there as well. We can get back to you and work with the legislature on how that would work.
That'd be great. And then I guess the only follow-up I have is, for, you all in DHHS and the executive branch working with the agencies, where do you guys all fall into?
So what we are doing actively now is actually working with every industry in that phase 1B group. So we're actually reaching out to all of them. And if you can see, government facilities, healthcare, public health, all of that is listed there. There's something called continuity of operations. So in general, before COVID even, when you have an emergency, you understand what the bare minimum of staffing is to keep important infrastructure and things moving forward. So that is how we will be thinking about vaccine distribution within government as well. But I will tell you, we will be sticking to our principles and our phases when it comes to, again, keeping critical infrastructure, healthcare infrastructure in phase 1A, priority 1, front and center, as well as vaccinating in our long-term care facilities. And again, I'll keep emphasizing these phases will overlap. So even though one entity may be in one particular group, there will be overlap, and it may not be that one phase is complete before another one begins.
Thanks, Dr.
Thank you very much. And I did one more rule. Sorry about that. I didn't tell folks. We're going to have to limit you to one question. So just because we want to make sure everybody gets a chance here if we can. Kim Craig, go ahead and unmute yourself and ask your question.
Sure. Thank you much. I don't know if it's possible to turn anybody's video on, whoever answers, only because then we don't have to get stuck into putting a graphic over everyone's face. But my question is, you know, obviously we've heard of a lot of industries that are sending letters to the governor so that their workers can be prioritized. How is that working, and what sort of industries and are being prioritized, and where would they fall into on the vaccination priority chart?
So I would say we have actually engaged a stakeholder group to, again, based on those principles that I went through. This is not first come, first serve. This is about principles and principles of keeping critical infrastructure open. So that is how we're looking at that. We have received some correspondence from various industries, and we do review those letters and consider everyone's input. But again, we are, again, keeping with our principles, guidance that has come from the CDC and the ACIP as we have thought through this interim guidance for prioritization. And I emphasize interim because it is very possible that this may change. And as with everything in COVID-19, we've had to pivot, be nimble, and evolve as we learn more.
Thank you, Doctor. Mark Cavett, you can unmute yourself and ask your question.
Dr. Caldoun, for the time being, will the federal government be sending out vaccine allocations without the need for states, hospitals, and local health departments to make specific vaccine requests? And do we know when those local entities will be able to request vaccine on their own?
Bob, do you want to take this one?
Sure, I can. So our initial allocations, we have surveyed all of the hospitals. We know the approximate number of staff that they have and the staff that need to be vaccinated. So our initial push here on day one is to push vaccine out to them, but unfortunately we don't have enough vaccine to cover all their staff. At that point, then it'll be that they will make requests to us to cover the remainder of the staff that they need. We just want to get them started, and then once we know more about what vaccine will be available, we will make that, they'll be able to order that from us and we can send it out to them.
Our next question, Justin Hicks, I'm live.
Yeah, thank you. This question is for Dr. Caldoun. Your slides, I think it was phase 2, was talking about individuals 18 and older. I know yesterday during the FDA advisory panels meeting, they had a lot of discussion about the minimum age being 16 years old. I'm just curious, for 16 and 17-year-olds, will they be advised not to get the vaccine in Michigan, or kind of where do we stand with that?
That is a great question. As I indicated, these things tend to evolve even by the day. So we are aware of that vote that occurred yesterday in the age of 16. But again, we have not actually received official guidance or recommendations as far as who the vaccine will be recommended in. And so up until last night, the guidance that we had gotten working with our federal partners had been 18 and up. If they do recommend age 16, we will, as I've been saying, this is always interim, we will update our guidance sufficiently. But at this time, we have not received any additional information saying that we should change at this point, and we are awaiting that final vote and recommendation.
Okay, thanks. Next, Alex Ebert, can you please unmute yourself and ask your question?
Good afternoon. Thanks for doing this. This is for Dr. Caldoun. That industry list of specific infrastructure that is integral with those essential workers is incredibly long. Can you say who among that list will be first in line? You know, where will GM be in this, or where will the, energy workers be in this? That has got to be hundreds of thousands of workers. So thanks for clarifying, if you can, who actually isn't first and last.
So it's a great question. I will say, again, what we are working through right now, it will not be every single person who works in those industries that gets vaccinated in this particular phase. It will be people who, based on our SCLC, our staff in the department are working on this every day for the past several weeks, actually. we are identifying who the really critical people are to keep the very minimum functioning. So that may be different based on the industry, based on the company, it will be very different. So at this point, I can't tell you exactly who's first, second, third. Again, I want to emphasize there will be a lot of parallel administration of vaccine and overlap of these different industries. But you're right, there are a lot of people there. We're going to only have limited vaccine available in these various municipalities. So if there's only a certain amount available for a local health department, these industries will have to pivot and they will only have a certain amount available, and they'll have to identify who those critical infrastructure workers are to receive the vaccine.
Thank you. Chad Livengood, go ahead and unmute yourself and ask your question, please. Chad, are you there?
Yeah, apologies. Trying to find my Zoom. Dr. Khaldun, which hospitals specifically are going to get the first shipments? There was some different information out there and confusion about this. How will this initially be deployed in the first 24, 48 hours?
So we do know across the entire state who has the ability to accept the Pfizer vaccine, again, which is the first vaccine we expect to be approved, and how many people we know that they can vaccinate early on if they receive the Pfizer vaccine. I know there have been some reports out there for security purposes. We are not going to be identifying where those are. But we are aware, and we do want in the first several weeks for every hospital that has, and local health department that has the ability to store and administer either the Pfizer or the Moderna vaccine to have access to that. And that is what we are planning for right now.